High creatinine, 5 kidney healing vitamins you must take every day. High creatinine often rises long before symptoms feel serious, especially for anyone already in stage 3 or above. What most people do not realize is that a few simple vitamin choices each day can support the kidneys in ways medication alone cannot. Today, I will guide you through the 5 most important ones. Pay close attention to number 3 because most kidney patients never hear about it. And stay with me until the end because I also added a bonus tip that works beautifully with these nutrients. Let us begin with a nutrient that quietly strengthens kidney tissue and reduces the load of harmful molecules before they reach your bloodstream. It is known for its strong antioxidant role and its ability to support natural filtration recovery. The first one on the list is vitamin C. Vitamin C becomes incredibly important when the kidneys reach stage 3 or higher, because every nephron that remains functional is working harder than before, and vitamin C helps reduce oxidative stress on these delicate filter units. Oxidative stress refers to the harmful chemical strain placed on kidney cells, and vitamin C acts as a natural antioxidant that neutralizes these reactive molecules so the filtration surfaces stay in healthier condition for longer. Vitamin C also plays a meaningful role in supporting endothelial function, which means it helps keep the tiny blood vessels inside the kidneys flexible and smooth, so blood can enter and leave the organ more efficiently, which makes filtration easier and less physically demanding for weakened kidney tissue. Better blood flow through the kidneys reduces pressure on the glomeruli, which are the microscopic filters, and a healthier glomerular environment is directly tied to better control of creatinine. Another benefit of vitamin C is its ability to help prevent uric acid buildup, because excess uric acid can crystallize and form blockages that add stress to kidney filtration, especially in people with reduced capacity. When uric acid is managed properly, there is less internal inflammation, and kidney function often remains steadier. One thing that is very important is the source of vitamin C, because vitamin C from whole foods is far superior to synthetic isolated supplements for kidney patients. Whole food sources provide vitamin C in synergy with fiber, pigments, and natural compounds that enhance absorption while avoiding the sharp metabolic spikes caused by artificial forms. A medium bell pepper contains around 95 milligrams of vitamin C, which is already more than the recommended daily intake for kidney health. And a cup of strawberries contains around 85 milligrams, which also supports antioxidant needs, while a single kiwi provides around 65 milligrams. These natural sources allow the body to take in vitamin C gradually, without overwhelming the kidneys with a concentrated load. The safest daily intake for someone with stage 3 or higher kidney disease is about 60 to 75 milligrams per day from food, and patients should not go above 200 milligrams from supplements because larger doses can convert into oxalates, which may stress the kidneys. Have you ever tried tracking how your creatinine responds when you focus on food-based vitamin C instead of supplements? Many patients report noticeable changes in their lab numbers over time just by switching to natural sources. It is best to consume vitamin C in the morning or early afternoon because the body uses it throughout the day to handle metabolic stress. And food-based vitamin C does not require large water flushing at night, which could trigger nighttime urination. When choosing bell peppers or citrus fruits, it is wise to pick firm produce that is bright and intact, because dense, soft spots or bruises lead to higher histamine production in the fruit, which can trigger inflammatory responses in sensitive individuals. Storing peppers in a refrigerator crisper drawer keeps moisture balance stable and prevents premature nutrient loss. Two kidney-safe ideas include a simple bell pepper and kiwi mix that provides slow-release vitamin C without added acidity or salt, and a gentle strawberry and spinach bowl that supplies fiber and nutrients without irritating the urinary system. It is smart to avoid powdered vitamin C mixes, since many contain additional chemicals that convert into oxalates and may lead to stress on filtration pathways. Vitamin C beverages that are marketed as health boosters often contain high fructose or added sugar, which can raise inflammation and worsen kidney workload, so they are not a good choice. For those who are sensitive to citrus, kiwi provides a friendly alternative because it is less acidic. And for people on a tighter budget, the combination of bulk apples and kiwi can offer consistent natural vitamin C intake. Now we continue forward to the vitamin that strongly influences kidney filtration hormones and creatinine regulation, and that nutrient is vitamin D. Before we continue, I want to know where you are watching from and how long you have been dealing with stage 3 or above kidney disease. If you are working to lower creatinine and support kidney function, make sure to subscribe to Kidnease and tap the notification bell. If this content is helping you, type 1 in the comments, or 0 if it is not. Vitamin D plays a central role in kidney health because it connects bone metabolism with kidney endocrine signaling. So when kidney function declines to stage 3 or beyond, the body often loses its ability to activate vitamin D efficiently, which affects calcium balance and mineral regulation. This matters deeply because the kidneys help convert vitamin D into its active form, and when that conversion slows down, the bones pull calcium from storage, which increases calcium in the bloodstream and forces the kidneys to process extra mineral load that they are already struggling with. This is why vitamin D helps regulate the balance of calcium and phosphorus in the body, and stable mineral levels are directly tied to lower risk of vascular calcification and bone weakening associated with chronic kidney disease. Many kidney patients have chronically low vitamin D levels because the kidneys cannot metabolize it properly, and this deficiency is often overlooked until blood tests show clear imbalances. The National Kidney Foundation has noted that vitamin D deficiency is extremely common in kidney patients and is linked to higher inflammation and reduced filtration performance. Let's shift our focus to how vitamin D actively lowers inflammation and reduces protein leakage into the urine, which is known as proteinuria. Proteinuria is a marker of kidney stress because healthy kidneys do not allow protein to escape into the urine, and vitamin D helps strengthen the filtration barriers so they become less porous. When inflammation is lowered inside kidney tissues, the nephrons experience less physical irritation and maintain better function over time. Now we take a closer look at how to get vitamin D from food sources rather than only supplements, because food-based vitamin D is safer and gentler for the kidneys. 3 ounces of canned salmon provide around 450 international units of vitamin D, and this amount is enough to support daily needs when combined with additional dietary sources. 1 tablespoon of cod liver oil contains around 400 international units, which is highly concentrated, but must be used thoughtfully because it also contains vitamin A that should not be overconsumed. Many non-dairy milk alternatives provide between 100 and 200 international units per cup, and these are easy to incorporate in morning meals. The ideal daily vitamin D intake for kidney patients is usually 600 to 800 international units from food throughout the day, and supplements should only be used if approved after blood testing by a clinician, because excess supplementation can create silent imbalances that stress the kidneys. The body absorbs vitamin D more effectively when eaten with meals that contain natural fats, so consuming salmon with olive oil and herbs during lunch provides an ideal absorption environment. When buying salmon, it is best to choose options packed in water rather than salted brine. Because extra sodium forces the kidneys to retain fluid and raises blood pressure, which can worsen kidney strain. When choosing milk alternatives, it is wise to check the label for vitamin D added naturally rather than artificial enhancers. And oils containing vitamin D should be stored away from heat and light because light exposure breaks down the nutrient. Let's discuss a common misunderstanding. Some people believe that taking higher and higher amounts of vitamin D will automatically strengthen kidney health. But the truth is that excess vitamin D can raise blood calcium levels too high, which harms kidneys further and can even lead to kidney stones or tissue calcification. There is also concern that vitamin D supplements taken incorrectly can interact with calcium supplements, which is why self-dosing without professional guidance is risky. If this is valuable for your stage 3 or above kidney condition, please take a moment to like this video. It may seem small, but it tells YouTube that kidney health matters and helps Kidnease reach more people who need this guidance. Tap the like button if you believe more kidney patients need this. Now we move to the vitamin that is especially important for kidney protection, inflammation reduction, and improving nephron function, and that is vitamin B6. Vitamin B6 plays a major role in kidney function because it supports the way the body processes amino acids and waste. And this has a big impact on creatinine balance when kidney filtration is already reduced in stage 3 or above. This vitamin helps reduce homocysteine, which is a compound that can damage blood vessels and stiffen the microcirculation around the nephrons. So, keeping homocysteine lower helps maintain better blood flow inside the kidneys and reduces inflammatory stress. B6 also supports the formation of red blood cells, which improves oxygen delivery to kidney tissues. And when oxygen circulation is healthier, the kidney cells function more efficiently, even under reduced capacity. Many kidney patients experience chronic fatigue due to mild anemia, and B6 helps improve energy metabolism by supporting hemoglobin formation, which can make daily life physically easier and reduce overall strain on the kidneys. Now we take a closer look at protein metabolism because B6 is essential for breaking down protein properly and converting it into usable forms, which lowers the amount of nitrogen waste and reduces the workload that the kidneys have to process. When protein digestion is more efficient, fewer harmful byproducts reach the kidneys, and this reduces the pressure on filtration and slows creatinine elevation. This vitamin also helps decrease symptoms of fluid retention, which is important because swelling in the legs, feet, or hands is a major sign of kidney filtration imbalance. Patients often do not realize that fluid retention is not just water weight, but a symptom of altered blood chemistry, and B6 helps re-establish healthier fluid movement in the body. Moving forward to the daily food sources of vitamin B6, 3 ounces of turkey breast supply about 0.5 milligrams. And this is a clean protein source that is gentle on the kidneys when eaten in moderate amounts. A medium banana offers about 0.4 milligrams and also gives potassium in a balanced form that does not overload the kidneys when consumed responsibly. 1 cup of chickpeas supplies around 1.1 milligrams, which is a strong natural source, though chickpeas should be prepared in a kidney-safe way. Now we gain a deeper understanding of how to use these foods safely. Turkey should be lightly cooked instead of heavily fired or charred because high heat breaks down B6 and increases inflammatory byproducts in the meat. A chickpea and cucumber mash without added salt provides B6 along with hydration support, and this combination reduces pressure on the kidneys by minimizing sodium burden. A banana eaten as a mid-morning snack gives a steady release of nutrients and energy that helps keep blood sugar stable through the day, which is especially important for diabetic kidney patients because unstable sugar levels can damage kidney microstructures. When purchasing turkey slices, choose the nitrate-free version because nitrates are chemical preservatives that increase inflammatory stress and add unnecessary kidney load. If using canned chickpeas, always rinse them thoroughly because the liquid contains extra sodium and residues that are not kidney-friendly. B6 supplementation should be handled with caution because doses above 50 milligrams may cause neuropathy, which is nerve damage that can affect sensation and movement, and this is not reversible in some cases. It is also wise to avoid combining vitamin B6 with multi-B energy booster products because they often contain stimulant additives that are not safe for kidney patients. For cost-effective options, bulk dried chickpeas offer very high nutrient value, and frozen bananas provide stable stocking without spoilage. Now we continue with a vitamin that strongly protects kidney cells and supports creatinine clearance by helping cell membranes resist damage, and that is vitamin E. Vitamin E is highly valuable for kidney health because it is a fat-soluble antioxidant that shields the membranes of kidney cells from oxidative damage. And this protection helps the nephrons maintain structural integrity when they are under metabolic stress. Every kidney cell membrane contains lipid components that are vulnerable to oxidation, and vitamin E helps stabilize these fats so that the cell walls stay resilient, flexible, and capable of normal filtration activity even when creatinine levels are elevated. It also helps reduce inflammation in the tiny tubules inside the kidneys, which is important because inflamed tubules become narrower and less effective at passing fluid through the filtration network. When inflammation is lowered, the kidneys can move waste material more efficiently, and this leads to improved comfort and more stable lab results. Many kidney specialists and researchers, including teams at the Cleveland Clinic, have noted that antioxidants like vitamin E help support kidney tissue recovery through their ability to neutralize free radicals. Now I want to take a closer look at how vitamin E works together with vitamin C, because the two operate in a cooperative cycle that enhances the power of both antioxidants. Vitamin C helps regenerate vitamin E after it has been used by the body, which means that having both nutrients in the diet allows continuous antioxidant defense without interruption. This is helpful for patients with stage 3 or higher kidney disease because their kidneys are exposed to chronic oxidative stress over a long period. Have you ever noticed how even small dietary changes can influence how your body feels and how your kidneys respond? Many patients report subtle improvements when vitamin C and vitamin E intake is balanced through food. Next, we examine the amounts found in commonly available foods. 1 ounce of almonds contains around 7.3 milligrams of vitamin E, which is a moderate and natural dose that does not overwhelm the kidneys. 1 tablespoon of sunflower seeds provides roughly 5.6 milligrams, and these seeds are easy to integrate into meals without modifying texture significantly. Wheat germ oil is the most concentrated of these sources, providing around 20 milligrams of vitamin E in a single tablespoon, which can meet and exceed the recommended daily intake, but must be measured carefully to avoid unintended excess. The recommended daily level is 15 milligrams, and staying close to this range ensures that you receive protective effects without risking overconsumption. There are simple ways to consume vitamin E safely through everyday meals. A snack of almonds with apple provides fiber, minerals, and vitamin E in a way that does not spike inflammation, and combining crunchy fats with hydrating fruit creates a balanced nutrient effect. Adding sunflower seeds to oatmeal provides slow-released energy and antioxidant support for the kidneys, while also helping maintain blood sugar balance. A small amount of wheat germ oil mixed into a raw salad dressing allows for highly effective absorption, since vitamin E is better absorbed with dietary fat, and cold application preserves its nutrient structure. When shopping for vitamin E-rich foods, It is better to choose raw or dry roasted nuts rather than salt roasted ones, since excess sodium increases fluid retention and further stresses kidney function. Flavored nut blends often contain chemical seasonings that create inflammation in the body and place additional work on already strained kidneys, so plain forms are much safer. It is also important to consider safety, because high-dose vitamin E supplements above 400 international units can thin the blood too much, especially for those taking blood-thinning medications prescribed for heart or circulation issues. Vitamin E can enhance the effects of these medications, which makes medical guidance essential before supplement use. For people allergic to nuts, sunflower seed butter provides a practical, gentle alternative. Now we shift our attention to the final vitamin that plays a key role in creatinine metabolism and kidney detox pathways, and that is vitamin B12. Vitamin B12 plays a meaningful role in kidney health because it supports both nerve function and the formation of healthy red blood cells. And this matters greatly when kidney function is in stage 3 or above, since the kidneys often struggle to produce erythropoietin, which stimulates red blood cell formation. When red blood cell levels drop, oxygen delivery to tissues declines, and this leads to more fatigue, heavier metabolic stress, and higher creatinine retention. B12 helps correct the anemia that commonly appears in chronic kidney disease by improving the quality of blood cell production, and this reduces weakness and helps the body maintain better muscle metabolism, which directly influences creatinine levels. Now we examine nutritional sources with a practical approach. 3 ounces of lean beef contain around 2.4 micrograms of vitamin B12, which is enough to meet the daily intake requirement for most adults when digestion is steady and stomach acid levels are normal. Sardines are an even richer source, supplying around 7.6 micrograms from a 3-ounce portion, but caution is necessary because some sardine varieties are prepared with added sodium, which can worsen fluid retention and blood pressure in kidney patients. Fortified cereals provide around 2.4 micrograms per serving, which makes them a useful option for people who limit meat due to digestion or preference. Many kidney nutrition specialists highlight that B12 deficiency often goes unnoticed until fatigue becomes significant, so dietary consistency is key. Now we look into the best timing and absorption conditions for vitamin B12. It is most effective when taken in the morning because it supports energy metabolism for the rest of the day and can reduce the feeling of afternoon heaviness that comes from anemia. It is absorbed more effectively when eaten with a meal that includes protein, because protein activates digestive pathways that help the body extract and utilize B12 correctly. Choosing unprocessed meats rather than cured or chemical-treated products avoids harmful additives and makes the nutrient easier on the kidneys. When using sardines, it is safer to select versions packed in water rather than those preserved with sodium-rich sources. Moving further into safety and practicality, vitamin B12 is one of the safer vitamins because any excess is excreted through urine rather than stored, so overdose is rare when obtained from natural sources. Still, it is important to avoid fortified beverages that contain artificial sweeteners, because these sweeteners can alter gut chemistry and raise inflammation that indirectly affects kidney comfort. A useful practice is to keep track of anemia-related symptoms such as pale skin tone, fatigue, lightheadedness, or cold extremities, and monitor if these symptoms improve as creatinine levels stabilize over time. Now we go forward to the special bonus method that assists creatinine reduction through improved circulation and fluid movement, which is body heat therapy using warm abdominal packs. Warm abdominal thermal support is a simple method that helps the lower kidney region receive better microcirculation, and this improvement matters because damaged nephrons rely heavily on consistent blood flow to handle waste without becoming stressed. When gentle heat is applied across the lower abdomen, the small blood vessels in that area widen slightly, and this widening helps more oxygen-rich blood reach kidney tissues that often operate under reduced efficiency in stage 3 or above. Better oxygen flow supports the mitochondria inside kidney cells, and stronger mitochondrial activity helps the kidneys process metabolic waste at a steadier pace. Many kidney specialists, including teams at the Mayo Clinic, have observed that low-level warmth can support better overnight relaxation, which further reduces the tension in surrounding muscles that normally press against the kidneys when the body is under stress. A warm compress for 20 to 30 minutes before sleep encourages a calmer internal environment, especially when combined with slow breathing that lowers heart rate and reduces the pressure load on the kidneys. Some patients say they notice better morning comfort because the body maintains improved blood flow during rest, and this often reflects in more stable filtration patterns over time. It is important to avoid high heat because excessive temperature can irritate the skin and cause extra fluid shifts that overwhelm the kidneys. And people with diabetic neuropathy should not use heat if they cannot fully sense temperature changes. Now we move toward the final recap, so everything stays clear in your mind and you know exactly what to focus on next. Vitamin C lowers oxidative stress and supports healthier filtration. Vitamin D improves mineral balance and strengthens kidney hormone activity. Vitamin B6 supports metabolism and helps maintain better blood chemistry. Vitamin E protects kidney cells from inflammation and damage. Vitamin B12 improves red blood cell function and supports creatinine control. The bonus warm abdominal method improves circulation and encourages gentle detox support for the kidneys. If this video helped you understand how to support your kidneys, please subscribe to Kidnease, because we only speak to people dealing with stage 3 or above kidney challenges. And if you feel I truly understood your struggle, type relief in the comments. I want to know that this gave you hope.